It's made me more conscious of the possibilities of my life, not the constraints that my lung disease has given me. So I'm very happy.
The Fitness for Breath program is very unique for the Lung Health Foundation in that it's a program that we can deliver virtually.
So it provides ability for them to access physical activity on a daily basis. We have pre-recorded videos, but the best part is that we have live classes that we're able to offer.
What I find most intriguing about the Fitness for Breath program is the convenience that it provides our participants. It's easy for them to log onto their computer and get access to a personal trainer who's able to give them feedback.
This allows many of the barriers that restrict people with this sort of conditions to be able to take part in something that is meaningful.
Oftentimes people living with lung disease find themselves isolated at home, and because this is a fitness program that you can access from the comfort of your own home, it's really desirable for people.
Oh, I love the virtual classes. I can stay home any weather. We never miss a class. And it's good for people that can't drive. They'd be left out.
Without Zoom, without the virtual format, I would not be able to participate. I live out in the country, in a rural area. Having access through Zoom to resources is essential for me.
You don't have to spend money on gas, and you don't have to worry about what the weather is like. So this has worked really, really well for me.
I think one thing with the lung condition, you do have fear of leaving your home and maybe carrying your oxygen tank. There's also integrity there as well. They feel embarrassed. So I think just making them feel comfortable and kind of knock down those fears, and then also seeing others also with an oxygen tank and maybe moving similar to them as well.
What I love seeing from the Fitness for Breath participants is just how they are able to connect with other people within a community.
It's more than a fitness program. It's the friendships that they're able to build through the group, the support group that follows after that, and the access that they get to all the other services that we provide at the Lung Health Foundation. So the one-to-one support with our CREs, as well as the support groups, as well as just having friendships and people to socialize with outside the class.
Through our partnership with the Ability Center, we've been able to use their expertise along with our own expertise in helping people with lung disease and be able to collaborate in this program for virtual Fitness for Breath.
So often when we first sign on, they're so busy chatting and socially connecting that we have trouble even starting the exercise because they're forming friendships and talking about their conditions amongst each other. A lot of them don't really get the chance to socially connect within their community, so we kind of help to provide that.
The Keep Breathing program is a wonderful program. It provides a service that is lacking in our community, meaning support, exercise, and education for people with lung disease. The Keep Breathing program is successful because the people that are in it support each other. Even though they're not physically together, that they're together.
It's wonderful. I feel like I know all these people and I've never met them in person.
The community sense of this class is wonderful because there's no other place in the world that I meet people who have lung conditions. We understand each other. I'm not on an island anymore.
The benefits of the Fitness for Breath program to people with lung cancer is that physical activity is encouraged at each stage of the lung cancer journey. It improves cancer-related fatigue, improves physical function, as well as anxiety and depression. So overall, physical activity improves quality of life.
Many of these COPD patients that we serve, they have undergone major surgeries or they have decreased energy. And so this allows them to reserve that energy to really fully engage with the program and thrive.
They also get to experience all the improvements in their own fitness levels so that they can do more and be with their family and friends and participate in activities that they may have avoided in the past. And that is one of the most rewarding things that we hear from our participants.
We instruct according to how they should be breathing. So every exercise we say this is when you're inhaling, this is when you're exhaling. We finish every class with breath work, so it's very catered to their condition, which is why I feel like they really enjoy it. They feel safe in our hands because everything is always tied back to their condition.
When I first started, I could probably walk around the corner. Now I can do a block. I can put on my shoes without sitting down. I stand stand now to dress. So come a long way, baby.
It's just a class that I really, really enjoy. It's helped me so much. My breathing is 50% at least better. It's taught me how to use my inhalers and what to do if I do have an issue. It's just been a great class.
I had a breathing test a couple of years ago, and I was told I had 55% capacity in my lungs. I had one a couple of months ago, and I'm up 10. I am now 65%. I'm so happy about that.
I'm not as dependent upon people around me, and I love that feeling.
We all know that exercise programs for those living with lung disease is very few and far between.
It's good for everyone because there's a harder level to each exercise and there's always an easier level, so it's accessible to everyone.
I would definitely encourage people to take this class because it's so beneficial. I think it's really helpful and it's really good for everybody.
This has been just one of the most wonderful experiences I've had in 12 years of having COPD. I look forward to it every week. I guess I can't say much more than that. It's just wonderful.
At the Lung Health Foundation, we are dedicated to improving the lung health of Canadians.